So hip resurfacing is an aspect of my practice that I'm really excited about. Hip resurfacing allows young, active patients to really get back to a high level or a professional almost level of activity, right? And so there's not a lot of hip resurfacings done in the United States. It's kind of a select group of surgeons that do them and a select group of patients that are interested or eligible for hip resurfacing. But those patients that are eligible really, really love their hip resurfacings. So a couple things. With traditional hip replacement, we're basically cutting away the proximal part of the femur, and we're replacing it with metal or ceramic and plastic, right? And so that plastic wears out over time. So just like treads on a tire, the more use you put on it, the faster that plastic is going to wear. So even with our current generation of plastic that's very good, it's still not immune to the patient that wants to get out and run triathlons. It's still not immune to the patient that wants to play competitive professional tennis, right? And so hip resurfacing is a procedure that allows us to kind of sidestep that or give a patient that doesn't have the same wear characteristics or an implant that doesn't have the same wear characteristics. The other potential issue with hip replacement, that is, if you had a patient that needed to do a competitive sport or was, for example, rock climbed, or I've got a lot of firefighters that have issues, but you have to crawl into really awkward spots and you get your leg in a really crazy positions. And so there's always a risk of dislocation if you were to get into an extreme position with a hip replacement. And with a hip resurfacing, the other beneficial part of a hip resurfacing is that you don't have the same dislocation risks. And so what hip resurfacing does is it allows patients who are younger, who want to be professionally active or who have very strenuous jobs to have a more normal feeling hip and to have a hip that they don't have to worry about dislocation with, and hopefully a hip that they don't have to worry about wear as much. Hip resurfacing, instead of a traditional hip replacement where we cut away the proximal femur, with the hip resurfacing we actually just put a metal cap on the head of the femur and then we place a metal socket in the acetabulum. That allows for a couple things. Number one, it's a larger head size, which helps decrease the risk of dislocation. Number two, it's bone preserving, and so it gives the patient a more normal feeling hip joint, a decreased incidence of thigh pain. And then the third thing is it has better wear properties, and so it allows patients to be more highly active. And what I mean by highly active is almost to a professional standpoint. And so who's a candidate for hip resurfacing? Well, number one, it's males less than 65 with osteoarthritis who want to be extraordinarily highly active. And so this isn't a huge group of patients, but the patients that get a hip resurfacing absolutely love them. So the people that I do hip resurfacings on are professional tennis players, I've done NFL referees, professional karate players, and then a lot of folks who have very physical jobs. So linemen for the electrical company, firefighters, so these young 40 and 50-year-old folks, essentially, who have early hip osteoarthritis, and they don't want to subject themselves to a hip replacement that may limit them, right? And so these people undergo hip resurfacing. They have an implant that has equal or superior survivorship to a hip replacement for that particular group. And then in addition to that, they have a hip that feels normal and they don't have to worry about the same dislocation risks compared to a hip replacement patient.